A newborn baby has just been released from intensive care, and another BC child is still in ICU tonight. A reminder, the virus is impacting the young. While we haven't seen the surge in pediatric cases the U.S. has seen, one of the country's top doctors is warning our province not to get complacent. Here's CTV's Penny Daflos.
Whether they were in BC Children's Hospital or treated elsewhere is unclear, but the health minister has acknowledged a newborn and elementary-aged child were in ICU with COVID-19.
Happy to report that the infant in ICU has been discharged.
The ministry won't explain the timeline and how the child went from needing critical care to being at home literally overnight. Adrian Dix didn't announce the newborn was in ICU, instead tweeting statistics about overall ICU admissions and vaccination status that included that information.
Right now, I think there's one in ICU receiving critical care, and what we do have is a fairly low barrier for critical care.
The child still in ICU is between 10 and 12 years old. And it's true that children have not been hospitalized in large numbers in BC, but there were 9 last month compared to just 1 at a time earlier in the summer. And one of the country's top doctors points out
the impact of COVID on children goes beyond just the hospitalization. You know, of course, severe illness, death is by far the worst case scenario, but as you've described, there are many other impacts. Long COVID is one of them, and we're just starting to understand what that looks like on children.
With the Delta variant, about 2% of kids who get COVID end up in hospital. A third of them will go to ICU.
What those numbers show, our ICU numbers show by age group, is pretty straightforward. That people who are unvaccinated right now are at risk of some serious health effects from COVID-19.
In our country, the biggest group of unvaccinated people is, of course, people under the age of 12.
Then each infection carries the risk they could end up here.
Being hospitalized for a child and their family is a very traumatic experience.
Penny is here now. Penny, what does Dr. Smart have to say about BC's COVID protection in our schools?
Well, she's really advocating for every protection available, like masks for all kids in school, since the youngest can't be vaccinated yet. Smart also advised health officials here to be as transparent as possible with parents and the public, not just to ease anxiety, but to build trust and confidence as well, Mijang.
Thank you, Penny.